Hi everybody, it's Michelle here again with bearth.uhura. Here at bearth.uhura, I am a full spectrum plant-based holistic doula and an advocate for all things safe, natural, and effective. Here on this channel, we discuss all things pregnancy, birth, and womb health related. So if you guys like the content, you love what you hear, please be sure to subscribe. Today's topic is going to be about interventions, and specifically interventions that we don't necessarily know are interventions. I know that we have, the idea of certain interventions where pain medicine, surgery, um, those kind of interventions that are like the major medical interventions that we don't really those are the ones that we know, those are the ones that we are aware of. But there are some very um quiet interventions, ones that we don't really think are interventions, that we think is normal or routine, or something that is just a thing, like we accept it as it is. And so I want to speak about these interventions because these interventions often lead to the rabbit hole of other interventions, being induction, being cesarean, being, um, you know, medications that may have to lower your blood pressure or medications that may have to raise your blood pressure. All of these smaller early on interventions that we don't often think about are contributing and can contribute. Not always, I'm not going to say they always contribute, but a lot of the times we are seeing that they do contribute to um, the myriad of interventions that a lot of us are seeing, especially in Western society, especially in America, as we really do bad with our maternal health services. We really do bad with our birth services. And this is sad. So let's get into it. Let's talk about these interventions. So you might not think that this is an intervention, but the minute you walk into the hospital, that is probably your first intervention. And I'm going to explain why. And I'm not telling people not to go to the hospital. I'm going to explain what I'm saying before, this is all over. If you are a person who goes into this hospital uneducated, you don't know what you're looking for, you don't have a plan, you don't know if you're coming or going, you don't know if you're in active labor or you're early on in labor, you haven't listened to your body, you haven't taken care of yourself, you haven't nourished yourself, all of these different things. If you're a person who lacks the knowledge, and I'm not saying this means that you're ignorant, I'm not saying that this means you're stupid, I'm not saying any of this stuff. I'm saying that we can't put our maternal health, we can't put our medical needs when it comes to childbirth, or we can't put our personal needs when it comes to childbirth in the hands of the medical system. We have to be educated. Yes, we didn't go to school for it. Yes, we might not be a doctor. Might not be an OBGYN. We might not be a labor and delivery nurse. We might not be a doula. We might not be any of these things. But you can educate yourself before you step into that birth space. If you are somebody who hasn't done this, if you are somebody who doesn't understand nutrition and fertility, nutrition and your prenatal nutrition, in the different stages of your birth journey, you have walked into the hospital and it's already an intervention, because now anything can happen and you're just going to say okay because you aren't educated and you trust everything that everybody else is telling you. That's your number one intervention. Then when you walk in, they are already giving you a bed number. That's an intervention. Your room number is already started to be an intervention. There, you're being treated like a patient, like a number, and not like a person who is about to do a miraculous thing. You go into the room, they tell you to take your clothes off and put the what on? The hospital gown. That is an intervention because you don't have to do that. You don't have to put that gown on. You don't have to wear what they want you to wear. You can wear what you feel as though you're comfortable in. You can wear a comfy dress. You can put on a robe that can easily go on and off. You cannot wear anything at all. You can wear your clothes. You don't have to do that. That is already giving your autonomy. You're taking yourself out of your own personality and you're giving into the environment of, I'm a patient here in this hospital. When you think of a hospital, you think of a hospital gown, you're thinking of a sick person. You're not thinking of a pregnant person. Most times when people see, if you ever watch the show or you watch the movie, the minute you see that person in a hospital gown and you see a hospital and a hospital bed, you're automatically thinking sickness. You're automatically thinking something is wrong with that person. You're not technically thinking pregnancy. So that is an intervention. The IV is an intervention. It's an intervention because you may not need that IV. You may already be hydrated. Now you have a cord attached to you along with a pole, and you have to, your mobility is restricted. That's an intervention. When somebody comes into the room and say, you can no longer eat, you can only have clear fluids or ice, that is an intervention. We don't think of that as an intervention, but it is an intervention because intervening means to interfere with your regularly scheduled program. They are stopping you from being able to eat because they are possibly planning for a surgery, which is a C-section, right? The only reason why you can't eat is because you may need a C-section. In a C-section, they don't want you to aspirate, they don't want you to choke, they don't want you to throw up on the operating table. So this is why you can no longer eat, but that is an intervention, right? So all of these things are interventions. When somebody says to you, oh, lie down, I'm going to check your cervix. That's two things. That is not informed consent, and that is also an intervention. There is no need for cervical checks unless you want to. If you don't want to, there's no need to do it. It is an intervention. It is not routine. Well, it is a routine for them, but it is also an intervention because sometimes cervical checks turn into membrane sweeping. Whether it's because the person is rough, whether they just take some upon themselves to say, oh, we're in here. She's already 3 or so centimeters. Let's just get a little bit. Let's just get it going. That is an intervention. That is not, that's not something that needs to happen. Also, checking the fundus after birth. There's a difference between just checking it and massaging it. Massaging is an intervention. Most of the time we're seeing that, or most of the time I'm hearing that when a client or a general, like in general, women come to me and say, oh, that was the worst feeling ever. They told me they were going to check my fundus to make sure my bleeding was okay. And they, they pressed down and they, turned their hand in a circle and they grabbed and smushed. That is not checking. That is not gently placing your hand and feeling for the hardness of the uterus. That is not, that is a massage. You're massaging at that point. That is an intervention. So sometimes we think that that's normal. No, they can check without massaging. They can teach you how to check without massaging. And even with the massage, you should never be so aggressive so much that you are in tears. That is aggression. That is obstetric assault. That is not informed consent at the end of the day. So these are things that you need to pay attention to when you are in your birth space, whether you are with a midwife, whether you are with a hospital, whether you are at home. You have rights in any of these settings. These are your rights. So I think that a lot of the times we don't understand that these small, subtle things are, in fact, interventions that we have not consented to. We have not said yes. We have not been told that we have options. We have not been given proper information on it. We're just like, oh, this is normal, this is childbirth. They know what they're talking about, and I just have to follow the lead. But actually, they should be following your lead. Actually, you are in control. Actually, you need to speak up. And let them know that these are the things that I do want, these are the things that I don't want, which is why birth planning is so important. Postpartum planning is so important. Um, and I have videos that discuss how you do that and the details and what you should include in it. But these are things that we don't think about. These are things that we don't ever even discuss after we feel as though it was wrong, or if you feel like, maybe I should have did that, or I wasn't really comfortable with this, but we don't speak up. We have to hold people accountable. We have to speak up. We have to speak out for ourselves, because it is important, and you deserve to be treated like a human being, like a person with rights and autonomy. And that's pretty much it. So it's really important to think about those things. Think about how you've educated yourself before you walked into that birth space. Think about how um, you feel about the different birth atmospheres and environments. You want to really be sure, like, if you're somebody who, you don't really like confrontation, and you don't really want to um, push and pull, and 9 times out of 10, the hospital setting is probably not going to be the best thing for you. You need to find somewhere else to birth. You need to find like a birth center. You need to find someone who's willing to do your home birth, a midwife. You need to find some other option, even unassisted, if you are strong enough in your knowledge and confident enough to do so. But most times than not, your experience isn't going to be completely smooth, because they have a set of requirements, a set of routines, it's a certain way that we learn in our system that causes us to feel like, if you don't let me do this, if I cannot do that, if I am not able to do this, I can't do my job right. And if I can't do my job right, I can't protect you and your baby. And if I can't protect you and your baby, then I can't be efficient at what I'm doing. So therefore, you're in my way. And now we have friction. So I don't necessarily think these medical providers are doing it out of spite or out of anger or out of some, crazy situation, but this is the way they are taught. This is the way they learn. So if that is the case, then they think they are right. But in actuality, making sure you're comfortable, making sure you feel safe, making sure you feel like you can trust the people that are around you, making sure your voice is heard, making sure you are at ease and managing and coping as much as you possibly can in this time of intensity that's the most important thing. That's the most important thing. Yes, we want to make sure babies is doing well. We want to make sure the heartbeat is good. We want to make sure your heartbeat is good. We want to make sure all of your vital signs are good. But if they are, and if everything is fine, then we don't need to be intervening so much. We don't need to be intervening at all if birth person does not want to do that. It's their choice. It's their option. And we have to get into a place of, how do we feel when we're in the birth space? I often have to ask myself that. I often have to think like, okay, when nurses, you know, L&D nurses or OBGYN, when they actually have their own children, do they experience these things? Do they experience trauma? Do they experience the feeling of not being heard? Do they experience the feeling of, um, violence, aggression? Do they feel any of those things? And yes, I have heard a few stories and saw a few interviews where some nurses had to be on the other side of the fence to see that, wow, I have been doing this to people my whole career, and now I have experienced this myself, and now I want to change something about this system. So I've heard these things too. So it is important for us to look at it from, a 360, a whole circle, because sometimes, we're just, you go to work and you just do what you're supposed to do. Like, you build, your idea of what I'm supposed to do. You go, you want to be the most efficient person. You want to be, all of these things. You're in competition with other people. And, your turnover is like, oh, my turnover is this percentage, and like that is ignorant, that is crazy, and that is not something that we should be playing with when we're talking about the lives of pregnant women and the lives of their babies. You know, this is not a game. It's not a competition. It's none of that. Slow and steady wins the race. Patient kindness wins the race. Compassion and empathy wins the race. We have women who can leave the hospital and who could leave their birth spaces feeling full and fulfilled and amazing and loved and cared for and worthy and mentally stable so that they can take care of their children. Um, that's what we want to do. That's where we want to go. We don't want to do the opposite. We want to go that way. So that's pretty much my take on interventions that we may not think are interventions. I hope this was useful and helpful for someone. I hope it brought light to something that you may have experienced or may have felt in the past that you weren't sure about. But yeah, hold these people accountable. You know, discuss these things with these people. Tell them no. Um, you know, put them in a scenario. Ask them if this was them, how would they feel? And I don't. This is my favorite, but least favorite thing that when I hear this, all that matters is your baby gets here safe. Yes, that's very, 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 very important for my child to get here safe. But that is not all that matters. Stop saying that to us. Stop saying that to women. That is not the only thing that matters. My sanity matters. My rights matter. My body matters. My mental state matters. I freaking matter too. Just as much as the baby, because I am the person who has to care for that baby. I have to go home and provide for that baby. And if I am left silent because you don't care about what you have done, or they don't care about what has happened and has occurred, and I don't get a voice to say, you know, no or yes, or to reconcile what, you know, went on, then that's unfair and that's stupid and that's absurd. So we have to get out of that. We have to learn that, you know, that's just not, it's not it. So I'll see you guys for the next video. Thank you again. I'm Michelle. I'm full spectrum holistic doula. And peace and pregnancy deaths.